Now, according to the Centers for Disease Control and Prevention, up to 3 million sports and recreation-related concussions happen each year in the U.S., most of those affecting young men between ages 16 and 25. And although the majority will recover quickly and may never lose consciousness, others may experience continuing difficulties related to those injuries. And today we have nationally known physician expert, also known as Dr. Lori, here to provide us a State of the Union of concussions and also an update on the new protocols. So welcome here. We're excited for you to be here. Let's take a step back. As we were talking off air, when I was younger, it wasn't a thing you thought of a lot. You know, we headed the ball in soccer without any problems. We played hard, and if you got knocked down, you just got your bell rung, you got back up, you dusted yourself off and moved along. But now, that's different.
That's absolutely right. And the numbers that we think we know about the rates of concussion are woefully low. And we know that. And the CDC has embarked upon a program to try to capture the numbers of concussion so we have a better idea of the scope of this problem. And the CDC estimates that maybe only one out of 9 concussions are actually captured. And so part of this is, as a medical community, we were very slow to recognize this as a problem. And you're absolutely right. When all of us grew up, there was no such thing as concussion. I never heard the word concussion growing up. And if anybody did get hit in the head and had a few symptoms, maybe dizziness or lightheadedness or headache, or maybe even worse, loss of consciousness, or had to be helped up, well, you just kind of dusted yourself off and you got right back in. Yeah.
Now, what are some of the things, like I'm an assistant coach on my son's soccer team, you know, they can't use their heads, they can't do headers anymore because of the concussion scares. But what are some things that I should be looking for? What are some signs of concussion maybe after seeing, you know, a player fall down or take one off the head?
Well, one of the things you want to assess for is, are they conscious or not? Most patients who have a concussion do not lose consciousness.
Really?
And so they don't lose consciousness, so it is a myth to think that if you did not lose consciousness, it can't be a concussion.
Okay.
That is a myth. But you want to be mindful that a patient may have had, a player, one of your kids, may have lost consciousness even briefly. That obviously is a sign of a brain injury. If they're not focused on you, if they can't track, if they seem to be confused, they don't respond to your questions well or pay attention, look at you. If you need to assist them to standing because they're uncoordinated and their balance is off, those are signs on the field that they probably have a concussion. Those are certainly signs of a concussion.
We talk over here a lot about pre and post concussion testing. What is that, and when should a child or an athlete have that test?
Well, what you're referring to is what we call neurocognitive testing, just kind of a baseline of how you think. It's not an IQ test or an aptitude test, but a baseline of how you think relative to memory, focus, concentration, processing. And if you have that data before you are unfortunate enough to have a concussion, a physician can test you after the concussion and compare it to your baseline.
Really?
So historically, over the last 16 to 18 years or so, there's been the development of software programs, the most common of which is IMPACT. It's an acronym, Immediate Post-Concussion Assessment and Cognitive Test. It was developed out of the University of Pittsburgh and widely used.
Really?
It is used exclusively in the NFL, in the NBA, National Hockey League.
So they have that baseline data in which to assess from after that injury.
That's absolutely right.
And that's something that you could probably set up with your little soccer team or your baseball team or whatever it is, and you could already have that data on hand then if anything were to ever happen.
That's right. And you can get testing from 5 to 11. That testing is on an iPad, and those kids enjoy that.
Yeah.
And then up to age 59 after that. And there are some studies now to extend that and have IMPACT available to seniors.
Wow, it's incredible how much has come here in just 30 years. So, and to have that data available beforehand, and then especially afterwards or unfortunate injury, you know, the doctors can have that information to go ahead and treat those kids and treat our athletes as best as they can.
That's right, and it helps with the medical decision making, no question about it.
All right, well, Dr. Lori, we appreciate your time here today. For more information on the concussion management program, make sure you go online to MidwestSportsCare.com.